Hey listeners, it's Paul Andriola here. Why not join our community at Small Cap Discoveries, where we offer our members direct access to some of the best microcap investment opportunities available. Our members are getting access to premium microcap financings, research reports, and direct access to management. Sign up today at www.smallcapdiscoveries.com.
One. Hi, everyone. Welcome to the Small Cap Discoveries conference call. Today on our call, we have the CEO, Kate Torchilin from Hamilton Thorne. Hamilton Thorne trades on the TSX exchange under the symbol HTL, and it also trades on the OTC under HTLZF. The company is currently trading at $1.38 with about 153 million shares outstanding, or about a $211 million market cap. I'd also like to highlight that today is April 11th, 2024. I'd now like to hand it over to Paul Andriola.
Hey, thanks a lot, Trevor. Welcome, Kate. Happy to have you on board. Hamilton Thorne is a company that's very near and dear to SCD and certainly my heart, because it was the very first company we ever recommended and highlighted. So we've got a lot of happy, either past shareholders and hopefully a few that are still existing shareholders, but happy to have you on board. Now, Kate, you're relatively new to the company as far as the CEO. So we welcome you and congratulations on your new position. So yeah, we would love to get to know Hamilton Thorne a little bit better and obviously updates. So I'm going to hand it over to you and let you start your presentation.
Thank you. And thank you, Paul and Trevor. And it's tremendous to be on and just having an opportunity to share a little bit more about Hamilton Thorne. As you mentioned, I joined about 3 months ago and cannot be more delighted by the choice I made, and really looking forward to continue building on what is already very, very strong foundation and really exciting company. But we believe that there are even brighter days ahead, and so it's really great to be here and share the story. Given our public nature, right, we'll make some forward-looking statements, and we're covered by the regular, anticipated disclaimers for that presentation. Maybe just quickly orienting the audience as to what Hamilton Thorne is, especially for the ones who are a little bit newer to our story. Hamilton Thorne develops, produces, and markets precision instruments, laboratory equipment, consumables, software, and services for infertility industry, also referred to as assisted reproductive technology industry. We'll talk some more about that. It's obviously extremely inspirational and very central to human health, part of healthcare. We're headquartered in the United States, traded on TSX. We're really a premier supplier, and we operate in an industry that is very important part of healthcare. We're very driven by the quality of products that we do. We're very, very driven by technological and scientific advances of what we do. And over the last several years, we believe we've been able to pretty consistently drive performance above market organic growth. And I'll talk some more about how we go about it and why we think it's going to be sustainable in foreseeable future as well. We operate in an industry that is very important, very exciting, but is also a very young industry and happens to be very fragmented. And so with that, companies like Hamilton Thorne, with kind of the right approaches and the right tool set, we can be quite acquisitive and really build our growth both organically and inorganically. There is a lot of new exciting technologies, smaller companies, and so on that we can bring and have been over the last several years bringing under Hamilton Thorne umbrella and then accelerating the growth and so on. And just to summarize, we're global. We're really flattered by the trust that our 2,000 plus clinics, IVF clinics and customers put into us. We operate in 100 plus countries globally, and continue, have been on a pretty substantial growth trajectory. Just a little bit on what is assisted reproductive technology kind of industry. And basically, it's an industry that develops and promotes and then applies to patients various technologies to help people and families get to a healthy baby and starting families in the situations where there are some kind of healthcare or otherwise difficulties in doing so in more kind of natural ways. It does involve working with oocytes and eggs from female patients, and then semen and semen analysis and understanding male reproductive issues, and then ultimately generating an embryo in the embryology laboratory and the infertility clinic, and then maintaining that and eventually evolving into a successful, happy, healthy pregnancy. Globally, right now, there are more than 4 million artificial reproductive, assisted reproductive technology cycles being done every year, resulting in more than 1 million babies being born every year. So it's already making very, very substantial impact on health globally. The market has been growing quite substantially. We define our specific market. Again, we do pretty much everything you see behind me. It's kind of supplies and instruments for the laboratory that actually processes oocytes and semen and works on generating and maintaining embryos. So we define our addressable market within the whole really multi-billion infertility industry. Our addressable segment is just under $1.5 billion. And it's very global industry, with Europe being probably the first mover in terms of various reproductive technologies. But right now, Asia growing probably the fastest, albeit from a smaller base, and then North America being somewhere, America's being somewhere in the middle. And again, very fragmented industry, where probably at this point, one of top 10 players. There is really no like behemoth in our industry, but there is a long, long tail of smaller companies. And over the last several years, Hamilton Thorne really has been building out, we've been building ourselves into a contender, emerging contender for top companies in our space. Without spending too much time on that, and by the way, for anybody who wants to read everything I'm just saying slower, this deck is also on our website, Hamilton Thorne Ltd. So you can download this deck and read it more carefully. But yeah, it's a really substantial and growing segment of healthcare, with 1 out of 6 families currently experiencing some kind of fertility issues, right? And the more population ages, the more environmental factors there are, the longer people wait to have families, the more and more of an issue infertility becomes. And that is one of the reasons why the tailwinds, we think, in our industry are really, really strong. And for the decades to come, we think it will continue growing at very fast clip. And we believe we're pretty well positioned within that industry. In the whole infertility treatment journey, what happens in clinical lab, so it's after the eggs are retrieved and semen is collected and the embryo needs to be generated, that lab plays very, very central, critical role in the whole infertility treatment journey. And again, from Hamilton Thorne standpoint, we manufacture, develop, manufacture, and then market and sell everything that this lab needs in order to be successful and do its job well, right? So there are precision instruments that are used to really analyze and assess the quality of eggs and embryos. There are a variety of consumables that are used through the process of egg retrieval, for example, and so on. There are a variety of services that the lab requires so that everything is running smoothly. And we now amassed a really substantial portfolio of different products and different brands to be able to provide all of that to the lab. At the highest level, again, we, as you can see kind of from some of the pie charts, we've been on the journey of really rounding up our portfolio so that we have some capital equipment and instruments for the lab, but we also have a growing portion of consumables and services and software in our mix, and that is part of very consistent strategy of a company to first really rounding up the portfolio, but also ensuring that consumables become more and more important part of our portfolio because they tend to be more of a sticky and high margin kind of part of the our portfolio. And we're very well balanced geographically, and Europe, for historical reasons, is our stronghold, but we've been growing fast in America as well as in Asia Pacific region. Multiple locations globally, both from research standpoint, from manufacturing standpoint, from our commercial offices and customers. We really pride ourselves from being very customer centric. Again, we understand that at the end of everything that we do, there is a patient, and the patient is on a very sensitive journey of trying to get to a healthy baby and a happy family. And so we take that to heart, right? And so we partner very closely with physicians, with embryologists, and we really kind of pride ourselves for bringing both innovation and then maintaining a very high quality of what we do to enable successful procedures. And we've been very consistently so far, and definitely under my now kind of leadership, that will continue to be very important kind of areas that will lean in to drive consistent growth and expansion of our business and continue to bring best products we can for our customers. Right? There is we focus on organic growth and strengthening our own house and continue to leverage fully our portfolio and look for operational leverage. We innovate. Again, it's a life sciences, scientific driven part of healthcare, and the products we launch and how we enable better and better infertility treatment procedures is important. So innovation is very critical lever for us. And then externally, we understand that the field is really substantial. There are ample opportunities to partner, to bring technologies and bring capabilities into our company through acquisitions. And that's a really important part of our journey as well. We've been very disciplined in our acquisition approach. So first, we've been very active. I'll show it to you in a second. But really disciplined and selective in terms of identifying the companies that we think can really flourish within under our umbrella and within our overall portfolio. We've been trying to not overpay, right, for what we're acquiring. And so all of that, I think, resulted in pretty successful kind of journey over the last several years. And you can see the listed kind of from starting our journey as a company that invented and commercialized lasers that are used for various infertility kind of procedures in the infertility lab, through multiple acquisitions and multiple portfolio expansions, now being the company that we are. And again, going forward, we think that that path will just further continue. So just maybe to quickly kind of finish and sum up with a snapshot of 2023. We've been really kind of pleased with the year. We drove sales increase of 16%, out of which 9% was organic. That's above where we think market growth is at about high kind of single digits, maybe around 7%. So we always, that's a measure of our success. We try to outperform the market. We expanded our portfolio. One of our latest acquisitions called Genetics was a consumables kind of acquisition that is contributing to our revenue as well as our profitability. Our gross margin made a good step up as well. And with cash, we're cash flow positive company. We pay a lot of attention to this metric. And so that has been also moving in the right direction through last year. EBITDA, our adjusted EBITDA, is another area where we pay obviously close attention to. And we're on the journey of EBITDA expansion. Kind of last year, all in was about 17%, out of which Q4 was at 20%. And we think that this year, we actually released the guidance of EBITDA somewhere between 18.5 and 20.5% for the year. So with that, I think I'll start wrapping up and kind of open it for Q&A. One thing for people who have been maybe following our company, we actually just started as of this year, and that as of this quarter, actually, releasing a guidance to the market. We feel we're currently at the scale and at certain level of maturity of our processes, right? That we can really start predictably estimate our upcoming performance and really guide investors to it. And so that's what you will see from us. As well as mid-year, we'll host our first in a while Investor Day, where we'll share kind of a refined 5-year strategic roadmap with all of you. So thank you.
Fantastic. Thank you so much, Kate. I have to start by saying, like you said, you've only been here about 3 months. So would love to know a little bit more about your background directly and sort of how you came to Hamilton Thorne.
Yeah, thank you. Of course, love to talk about myself and Hamilton Thorne. So Hamilton Thorne actually was just like any well-run company needs to pay good attention to succession planning. And with David Wolf, who was CEO of the company for, I think about more than 10 years, and is really tremendous individual who put major mark on how Hamilton Thorne grew and developed. So David was considering kind of next steps in his very kind of distinguished life and preparing for retirement. He actually moved to become executive chairman of the company, and I'm very grateful for his support and how smooth the transition has been going. But so that was a planned transition. And so the company started, I think, looking for new CEO sometime mid last year, approximately. Where I came in and why I really found Hamilton Thorne to be tremendously exciting for me, and hopefully why they found my background useful. I have about 25 years of experience either being with or running life sciences and healthcare businesses. I'm a scientist by training, have PhD in biochemistry as well as MBA, but then really moved to run businesses, some very large life sciences businesses, spent 13 years with Thermo Fisher Scientific, that is the largest company in life sciences space, where I ran multiple really big global businesses and was really tremendously appreciative of kind of the schooling and the training that people go through within Thermo Fisher world. As well as I ran clinical diagnostic businesses and several startups, being in the Boston area where I am, no shortage of really exciting startups. One thing that was always constant, I think, for me through many of previous companies is being focused on the lab, right? Like scientific lab or clinical lab is so central to everything that happens in pharmaceutical companies, clinical diagnostic kind of field, and so on. And so I really came to appreciate the importance of the lab. And so now seeing the infertility and embryology lab being so central to our patient's journey, I think is very, very exciting for me.
That's fantastic. And I echo that. I think David Wolf has been one of the, I don't say premier managers of a small public company. I always view him as he deserves to be in the Microcap Hall of Fame, along with a number of other great companies. And I'm sure if he sort of blessed you with this position, I'm pretty sure he's got a very, very high regard for you as well. Let's talk about sort of the business as far as you've done a lot of M&A. I mean, there has been some innovation within the company, but I'm curious to see how you view innovation in R&D. What are you more reliant on looking outside to bring products and services in, or how much focus is there on R&D internally?
So I think at the highest level, we have been and will continue to do both, right? So as we grow up with most of the historical legacy of Hamilton Thorne is on what I would call precision instruments. So it's instruments that make some kind of complex analytical measurements, such as or generate complex imagery, such as lasers. And then we probably have one of the most complete and in the world portfolios of semen analysis systems called CASARs, including some through our recent acquisitions, as well as the ones that historically been part of the portfolio. And so for us to really maintain the cutting edge on those precision instruments, I think that's something we feel we can fully own in-house. Like we're experts, like we're world experts on lasers, on semen analysis systems. We have been also expanding now and building on that capability with more of AI type technologies. Obviously, AI is a hot buzzword right now, but we've been doing complex image analysis and adjusting the guidance to embryologists how to do the procedure based on complex image analysis for a while. Right. And now we can even further leverage all of the complex data sets and the newest things that come up with AI. So things like this, I think it's very important for us to continue to really own and be the best at. And then there are certain areas that we actually usually would look to bring maybe through acquisition before we start building on it. So for example, in the area of cell culture media and certain consumables that kind of touch the embryo and help it, stay healthy and grow, Gynemed that we acquired several years back came with a portfolio and expertise of doing this. So now we have this capability, but I'm sure there will be some other areas where we'll decide that makes more sense to buy rather than build. But one, maybe just a summary kind of statement for all of that. I believe that innovation is extremely critical in our field. And so for us to continue be very deliberate on how and where we innovate is very important. And we'll lay out further the vision for that during our mid-year Investor Day.
Fantastic. I'm going to take this time right now. I should have reminded everybody, if you've got a question you'd like me to ask Kate, please use the chat function and we'll ask that question. So we sort of talked about kind of what potentially, what direction you go with M&A or with product development. Just in general, I mean, the company is still growing. And when companies are growing, there's always more pieces that you need to bring to the table. What other resources or maybe people or areas do you feel that you need to focus on, or you might be missing something? Where do you see the things that you still want to sort of direct to?
So yeah, no, I think it's really good question, right? So from my perspective, areas that I would say customer facing and that kind of directly, affect the quality of interaction that our customers have with us is always very, very important, right? Again, they're handling one of the most precious materials in the world, right? So eggs and embryos. And so when they have questions, we want to always be there to pick up the phone and be able to guide and share and provide technical assistance and so on. So anything around customer support.
Motherfucker, man. Go tabarnak.
Hold on.
Maybe a little bit of a background.
Guys, yeah. If we could make sure everybody's muted. Okay, sorry about that, Kate.
No, not a problem. So that is very important. Continue to build what we just talked about, right? Innovation, and make sure that we have people who really understand technologies, who understand where AI is going in our space and so on. Another very important area. But ultimately, we're a manufacturing company. We develop, manufacture, and then sell products. So every function matters. Every function is important.
Yeah, no, fantastic. And then just generally, as the business, where do you think the challenges are? What sort of keeps you up at night?
I think one of the biggest things that we really think as the whole industry is about is how to, I would say, democratize infertility treatments, because probably one of the biggest barriers right now from patient standpoint, right? And as well as the whole industry, is that procedures remain first, not the most, first, they've quite expensive. The whole infertility treatment journey can be very expensive, and it's very patchy across the world, right? Of how it's being covered by states or by private enterprises. Also, while success rate of infertility treatments has been substantially improving from 30 years ago, 5% success rate, to now we're at about 30+% success rate from a given cycle. So really substantial improvement still, right? Like it's 30%. So it's there is a lot further room to improvement. And so us, as well as pretty much every one of our customers, are thinking very, very heavily on how to help standardize, improve success rate, and ultimately also democratize and expand access to infertility treatments.
Gotcha. So clearly there's a heavy M&A focus here. You mentioned that the company's kind of in the top 10 as far as largest within a very fragmented industry. But what's the competitive landscape look like on the M&A side? When you go up to either compete or to try to buy a business, are there a lot of other players that are doing the same thing within this industry?
I would say generally, probably the level of activity is increasing, and I think it has many positive elements to that as well. Because I would say, and I'm mostly learning it from David, because obviously I wasn't there, 10 years ago. But there were much fewer acquisitions or even like discussions of that sort that were customary to our industry before, but many companies were started by initial founders, and so they were still like kind of building the enterprises. And now we come to a certain level of maturity in the industry. First, there were bigger players. Second, many of the original founders are coming into retirement age, and that was actually one of the reasons for several acquisitions that we made, right? So there is a natural, again, change in ownership, and so general level of receptivity that this is, one of the good ways to further kind of transition out of the enterprises to sell it or have it acquired. I think the relationships that Hamilton Thorne has built over the years across our industry is helping us, right, to stay, I think, as top of mind, right, for when different things come up. And so again, will be my job to continue maintain this reputation of people who are, we're a slightly bigger company, will continue to be bigger and bigger, but we're extremely passionate about what we do, and we really care, right, about companies and technologies that we acquire.
Fantastic. And then, I mean, it can be the other way around. I imagine you guys could end up being a target to be acquired as well. Generally, do you have to get bigger before you sort of get that notice? Or, I mean, are you getting sort of inquiries right now if the business is up for sale? What sort of does it look like on the other, sort of looking the other way?
I think being publicly traded company will continue to explore all kind of venues that make sense for our shareholders. I think that being said, I typically, right, like putting my, Thermo Fisher hat on, typically to enter really for like a bigger player to enter a new segment like this, they will be looking at somewhat bigger footprint to acquire. And we definitely don't build a company to sell, right? We build a company to be a long-term leader in our space, and then we'll see what happens, right?
Yeah, no, exactly. Good. Okay, so as we sort of wrap up here, investors are always kind of trying to understand where they should pay the most attention to. If you're talking to investors, what do you think are the catalysts or metrics or anything within the business that we should focus the most on to make sure that we understand how successful the company is executing?
Yeah, so I think probably nothing groundbreaking, but to see healthy top line growth combined with expanding of EBITDA. I think that's where, I know as a person who runs the company, I'm paying a lot of attention. So I think it's a good place for investors to pay attention as well. And ultimately, we feel that, I mean, every other company probably sells that. We feel that we're a little bit in a lump with our stock price. And so putting a lot of attention to how we actually now will start consistently guiding the market and beating, and like at least first meeting and then eventually beating, right, our promise, and hopefully leading to nice value creation for everyone.
Fantastic.
So I would look at our ability to meet our financial commitments as well consistently.
And then Kate, what is there any sort of key takeaway, or what's the key message you want to make sure everybody walks away with today?
Yeah, no, thank you. I think first that infertility and assisted reproductive technology is tremendously exciting industry. Within that, Hamilton Thorne is positioned as emerging contender and will be one of the leading companies going forward. And that we're really excited about what we do, and hopefully investor base will continue to be equally excited.
Well, listen, on behalf of my family and what you guys are doing for IVF, my two youngest are a production of IVF, so we're big champions of this. Sometimes when they drive us crazy, we sort of maybe we're a little upset about it, but no, a fantastic industry, fantastic people around it. Clearly, what Dave has put together and what you have now inherited, I think, has been a tremendous business. And we obviously wish you continued success, and we'll continue to sort of watch you closely, and we hope we can get you on a future date and we get an update. So we've been speaking with Kate Torchilin, CEO of Hamilton Thorne. Symbol again is HTL on the TSX. Kate, once again, thank you so much for joining us today.
Thank you very much. Thank you for having me.